Welcome to this webinar this evening, which is presenting the EndoVoices Project. I guess we're going to go around and do some brief introductions to ourselves who are here representing the project team. We'll come on to the much wider project team that's behind this. But EndoVoices is a co-production research project looking at the links between endometriosis, mental health and well-being. And we've been working with Endometriosis UK and the co-production collective at UCL and a number of patient researchers in that. I'm Izzy Braithwaite and my background is in public health, but I also have lived experience of endometriosis, and that was kind of one of the, I guess, drivers for working on this area. And I'll pass over to maybe Sarah.
Hi everyone, good evening. I'm Sarah. I'm a lecturer at UCL and I wear kind of two hats. One is an epidemiologist, so I study the kind of risk factors and causes of diseases, but I'm also a chartered psychologist and I have a strong interest in the relationship between mental health and physical health and long-term conditions. Like Izzy, I also have lived experience of endometriosis and I'm also really interested in co-production, which we'll discuss later. So I've got a lot of passion for this project. I'll pass over to Abby.
Hello, everyone. I'm Abby. I'm a patient researcher, so I come from a non-clinical background, but I have lived experience of endometriosis, and I joined this project just as a way of trying to make some input as a patient with lived experience and try and create some positive change that's well needed in this area. And I shall pass to Roshni to introduce herself. Thank you.
Hi guys, I'm Roshni Palmer. I am also another patient researcher and I joined this project with also having a lived experience, but also wanting to help the endometriosis space. So looking to try and improve mental health, well-being and endometriosis. Thanks. I'll hand back to Izzy now.
Great, thanks so much, everyone. And just to kind of go on and give you a little bit of background about the project. So as I've mentioned, it's a co-produced project aiming to better understand the connection between endometriosis, mental health and well-being. We will come on more to kind of what co-production means to us and how we've been trying to kind of use that in the project. But for now, just the introduction. So myself and Sarah are UCL researchers, and we both have that kind of academic background, but also the lived experience, and that resulted in, I guess, the idea for this project. And then we've brought together a project team, including 5 patient researchers, a number of different academic researchers in women's health, mental health, some clinicians, and then our partners of the co-production collective and Endometriosis UK. And we've had small grant funding from the UCL Grand Challenge of Mental Health and Wellbeing for this project in the first part of this year. So the kind of aims of the project, the main aims that we've been trying to address and some through the work that we'll be presenting here today are to explore patients' views on and interpretations of the links between endometriosis, mental health and well-being, and then to kind of identify questions and areas for future research, and also propose policy improvements, things that need to change that are related to endometriosis and mental health, all taking a co-production approach. So working really closely with those who understand this best, those with lived experience, and also a range of kind of relevant other people with different kinds of experience. I think I'm passing to, is it Sarah?
Yeah, so just returning to this term co-production, which is kind of a new term, but it's for something that we thought was really important. So as I'm sure lots of you are aware, a lot of health research is conducted by people with either clinical or academic experience, and it's kind of done without involving people who necessarily have the condition. And thankfully, that's something that's beginning to change, because as people with endometriosis, I think we all know we have quite a unique insight into the condition, and particularly kind of how it affects you and, you know, within the mental health space. It's very difficult to see that if you don't involve people with lived experience. So co-production means exactly that. So it's involving people who have a condition as well as other stakeholders, potentially at every phase of the study, which is what we've tried to do here. So within how we've designed this study, the questions we've asked and how we've asked them, the actual delivery of workshops, and how we're interpreting and sharing our findings. And the kind of aim of this is broadly to share power and to work in equal partnership for equal benefit. So to make sure that the kind of work of research is actually translated both into how people with lived experience view the condition, and also the kind of the benefit goes to the people who need it most. Could I get the next slide? So just to give a very brief overview, our co-production research team involved, really importantly, as this kind of middle pillar, 5 patient researchers who've been involved with us since the very beginning of the project, and we're really lucky to have 2 of them with us here tonight to discuss kind of their involvement and some of the findings as well. We've had 3 other patient researchers who we haven't named here, but they've also been really critical to the project. As you've already seen, we've also had the support of Endometriosis UK, and we have a team at UCL which involves people with both kind of lived and learned experience that have specializations that are important to different areas of the project, just to make sure we really get that kind of side of it right. And we also have 2 clinicians in gynecology who will be involved primarily in kind of translating our findings for that audience. And now I'll hand over to Roshni.
So, as mentioned, we were doing this project to improve the links between endometriosis pain and mental health and well-being. And we came up with a set of values which we believe were important when having the conversations, when having the meetings, and the shared values that we came up were with talking about compassion and making sure all of the project is based on acting with kindness and compassion towards each other, but also amongst ourselves. Justice, because we're committed to using this work to look at inequalities and to work towards fairer policies and services. Community, because we're looking at people with lived experiences, working together and building trust and relationships. Openness, we felt that we should discuss these experiences and points of view with one another and be open when sharing this without any judgment. And learnings, because we obviously also wanted to share knowledge and have some shared learnings together.
Thanks, Roshni. So I'm just going to talk a bit about the experience of being a patient researcher and sort of what our involvement has been and what that's meant for us as patient researchers. So it's been a really empowering and educational experience for me. I've really learned a lot, and I've grown a lot in confidence, not just as someone with endometriosis, but as someone who can now actively contribute to research, especially as a non-clinical person, and as well as shape how it's done. As a patient researcher, I've been involved right from the start, from reviewing ethics documents and helping shape the topic guides. We think through all the things that happened in the workshop, all the activities that we're going to use in the workshops. That was all done as part of the team, and we were all involved equally throughout, and we were all made to feel comfortable. Our voices were all heard. It's interesting, as someone from a non-clinical background, I was quite nervous to start with, but it was such a comfortable and open floor where you could say your opinion, not be judged at all points in the research. So being welcomed as a full and equal contributor is really boosted my confidence, and it's had a big impact on how I can advocate for myself in healthcare settings as well, which is probably an unexpected outcome, but nonetheless a great outcome. In terms of the workshops and the meetings, every time we had a sort of meeting or workshop, we'd always take time to reflect as a group afterwards on what had been shared, because some of it could get quite heavy. We took a space to debrief together, and that was very useful, not just to process what we'd heard, but also to think about how we could honour the voices and our values, and feed them into our findings and suggestions. It's really meant a lot to me to be a part of the project. It doesn't just include lived experience as a tick box exercise, but it really listens to and works in partnership with people with lived experiences. I'll wrap up by saying I felt really supported, valued, and it genuinely feels like I've made a difference being part of this project. So it's been an honour, and I think probably all of the patient researchers involved will say the same thing.
Abby, and I think all of us in the project feel similarly. It's really been quite a powerful learning experience. So we're going to go a little bit more into what we've actually done in the project and what we found. But to kick this off, we wanted to give a really brief overview of what researchers already knew about the relationship between mental health and endometriosis going into this project. And the very high level summary of that is, to be honest, not a lot. And what we know didn't look terribly good. So what was known prior to this project was that the few studies that have looked at this mapping across all the literature that was already available have found that anxiety disorders and depression are substantially more common in people with endometriosis, to about 2 times or 3 times greater likelihood of having one of these common mental health conditions. The way that this has been measured and studied is not always terribly strong, and I'll go into that very shortly. But there's definitely a kind of signal that there's more anxiety and depression in people with endometriosis compared to people who are not suffering with a chronic condition. There was also some studies around other kind of aspects of mental health, particularly around substance use or being hospitalized for your mental health. But there are fewer studies around this area, and there are many kind of areas that haven't really been studied in detail. For example, trauma, which is something we'll discuss later. So while that's coming up, so we know that there's these higher rates of common mental health conditions, and there appears to be higher rates of substance use in people with endometriosis. And there were some kind of vague nods in the literature as to why this might be. Pain, and particularly the impacts of pain, appear to be really important, which is not going to be a surprise to anybody living with endometriosis. And the kind of impacts that pain and the symptoms have on people's lives more widely. However, the kind of mechanisms as to why endometriosis impacts people's mental health were not very well studied. And something that was really lacking was the voices of patients, and in particular, the voices of people with the condition around solutions and what they would like to see changed as well. So these were the kind of core aspects that we really wanted to dig into in the study. So why this relationship is there, how people with the condition themselves understand it, and what we want to see done.
So this slide just explains what we have currently done in the study so far. We have had regular, as mentioned by Abby previously, we've had regular team meetings to go through firstly what co-production was, then try and find the people that we feel we would need to do a workshop. So we did an online workshop and we did an in-person workshop. And we were looking for certain criteria of people who, such as they actually had to be diagnosed with endometriosis, which we wanted to come in and or be online and to speak to us about their experience of endometriosis. And we had a reflection after the workshop as well, to discuss all the findings, which I'll go through the details of the actual workshop in the next slide, please. So as I mentioned, we had a 3-hour workshop with 12 people, and we obviously beforehand we had to get consent to make sure that we people were happy to be recorded and what the workshop was about, basically. And what we wanted to do is make sure people understood that their understanding of endometriosis, their lived experience, and how people found it compare and their mental health specifically. Now, I sat on the in-person workshop, and mental health was a big thing that was brought up, and how people were struggling, and therefore the relationship on their well-being and any changes they would like to see in the legal system, or even to see in the hospital wait times, such things like that. And we then had a presentation about what we already know, as Izzy and Sarah have mentioned earlier. And then we also shared some resources and had some time to just discuss on how we thought the workshop went.
So really, we're presenting an overview of some key themes that we've found so far in our qualitative analysis of the workshop transcripts. This is very much kind of work in progress, but we've done the webinar really to be able to share with you some of the emerging findings. Another thing I guess I wanted to mention is that there's, a few people that have contributed to this work as participants who've kind of come along, and we're just incredibly grateful to everyone that made this research possible by taking part in it. So very much want to kind of honour that contribution. And we're going to be presenting a few anonymized quotes just to give a bit more like depth and kind of richness and context to some of the wider themes that we'll be presenting. Thanks so much, Sarah. So this is an overview of the themes that we kind of found and how they grouped together. I'm just gonna make that full screen for me. So you can see that there's kind of 6 broad groupings under which a lot of kind of complex and quite sometimes, different ideas and themes did come out in those discussions. But this is just to give you a sense of some of the different areas, and then we're going to go into each of these in turn. So that was symptoms and direct impacts, both from the condition endometriosis itself or potentially from treatments, and quite a lot of different kind of complexity in there. Abby's going to talk us through that. We've got experiences and barriers that relate to healthcare, and there's both kind of more physical health and mental health aspects of that. There was a lot around navigating the emotional journey of dealing with this kind of difficult and painful condition, and that had many different aspects that we'll come on to. Various things about social and relational aspects for people, which can be family, it can be friends, and it can also be in the context of kind of intimate relationships and difficulties around sex in particular. And then there's political factors and also the role of advocacy kind of in this space, and quite a lot of different things that people felt helped, and discussions about like finding support and the value of groups. So we'll come on to all of those in turn. And I think we're handing over to Abby to speak to this one.
Thanks, Izzy. Yeah, so the first theme is, unsurprisingly, pain and symptoms, the direct impact of those symptoms from either the conditions or the treatments offered for the condition. So we'll start with pain and other symptoms. Many people describe constant life-disrupting pain alongside fatigue, digestive issues, and many other physical symptoms. They're often invisible but hugely impactful, as I'm sure anyone with lived experience will agree. Another thing discussed was fertility, pregnancy, and menopause, and the main topics here were concerns around fertility, navigating pregnancy, and managing early or surgical menopause, and how that has added emotional strain and uncertainty for many participants. We spoke about how it is not just a period condition and how it has impacts on your whole life. It doesn't just affect the body, it can disrupt education, limit career choices, strain friendships and relationships, and have a major impact on sex and intimacy. Moving on to diagnosis and treatment, although getting a diagnosis can be relief, the process to getting that diagnosis is often long and frustrating, and treatments, while they can be helpful, they can also bring lots of difficult and troublesome side effects that can often dilute the effects of the treatment. And then finally, the main theme of the research, endometriosis and mental health. The emotional toll is huge when you're suffering with this condition. Many participants described how living with the condition over time affects their self-esteem, identity, and overall mental well-being, way past just the pain itself. Many, many more effects than just the pain.
Thanks, Abby. This is, I'm going to speak to this. So I think this was a really kind of important area, navigating the emotional journey of living with endometriosis. And I guess many, many different kind of aspects to that. Some of you might be kind of familiar with the sort of stages of grief, and I think there was some resonance of that, but there was a lot of processing and like trying to kind of deal with all the different aspects that people talked about, and people talked about many different aspects, but some of the ones that we'll come on to around difficulties with the healthcare system and kind of feelings of gaslighting and so on, playing out really in a lot of different ways, a lot of anger, frustration with those things, with the kind of general injustice of the how kind of neglected it is as a condition and the way that people have been treated, and a lot of I guess also things around our sense of identity, our sense of self, our relationship with our bodies, and kind of having, trying to process the fact of a condition that obviously has a lot of different impacts and different for everyone, but kind of grief definitely came out in some of those conversations as a bit of a theme that the people had to kind of grapple with that big change and what that meant across all different aspects of their life. And that is something obviously that's very personal and different for different people. Some people talked a bit about feeling at points very kind of hopeless. Some people talked about suicidal feelings related to some of these difficulties, and obviously a lot of complexity as well around navigating kind of how to get support, which we'll come on to a bit with that. There was a bit of discussion around trauma. I think it's quite a kind of complex area, but there was sort of different viewpoints around that, and an acknowledgement that certainly for many people kind of going through this journey and having to fight for that good care often involves quite a lot of sort of traumatic experiences in addition to the direct experience of the condition that Abby's kind of spoken to. The point on self-gaslighting, I guess, is a term that we kind of used where what people were describing was the fact that we almost are kind of conditioned by like the social context to play down symptoms, to not really kind of be fully truthful about how much things are accepting us, to try and kind of keep calm and carry on, as it were. But even like to ourselves, perhaps that questioning of, oh, well, if they keep telling me it's just in my head, maybe it is just in my head, and the kind of corrosive effect of those kinds of things heard from others or healthcare professionals over time on people's own perceptions of their reality. And then I guess a bit of a kind of pushing back also that came out from people around actually, the need to trust yourself and to listen to your own body, and the real value of peer support and things in building that trust in yourself. So a lot of different things here in the emotional journey, but hopefully for those listening, that there's some kind of things there that might resonate. And I think there's a lot still to explore that could be really helpful for people in this. Would you go to the next one, Sarah? It might be a quote. So I guess I'll just let you have a read of this quote from one of the participants, which speaks particularly to that idea of kind of grief and one person's experience of the different sort of things that they had experienced that grief in relation to, which I think speaks to this quite powerfully. We go on maybe to the next one. So this slide, this talks about the experiences and barriers that people described in relation to healthcare, and we've kind of split that out, as I mentioned, into this kind of physical health part, so general healthcare, and also gynae healthcare. And there were many different barriers and issues that were raised here, some of which I'm sure will be really familiar. Certainly some of them are very familiar to me. But certainly this issue of kind of long waits that we hear so much about in the news, and it's just, you know, incredibly long, but really hearing people's kind of real lived experiences of like what that had meant for them. And the complexity as well, that it's not just a question of the long wait, it's that actually that long wait comes after often so many years of being turned away, dismissed, told there's nothing really wrong, or that, you know, scans not finding anything. And this was a group we required that already had managed to get a diagnosis. So I think there's a kind of, you know, a whole other group of people still seeking a diagnosis who don't even have that kind of point of validation. But when people came along, you know, had often had extremely long and difficult journeys to get to the diagnosis. Many experiences, I think, of gaslighting along the way, and people really spoke to lots of different like flavors of that. In terms of you know, being kind of dismissed on the basis that it was because of a mental health diagnosis that they had. That came out. Just more generally, the idea that it was just period pains kind of from quite young ages was certainly a really common theme around that. And very kind of dismissive and sometimes really quite uncaring statements and responses that people received in trying to seek help. Some experiences of just really poor care, and in some cases quite negligent care, I think, that well, in some cases really shocking, and a loss of trust kind of resulting from, you know, much of that, those different things, but then feeling a bit trapped really, because despite having lost trust in that system, still being kind of forced by the condition to have to keep engaging with it. And all of this obviously having a real toll on people's mental well-being and mental health, because it's just an incredibly difficult thing to be trying to navigate. Quite a lot of talk about the impacts of hormonal treatments on mental health and the kind of lack of non-hormonal options for people other than surgery. So this was either in terms of quite severe impacts people experience when they did have it, or a real wariness to try those things, knowing that someone's mental health was already a bit fragile, and knowing that those treatments can affect people in that way, was, I think, quite a common theme. And I guess one of the kind of recommendations around that was to do with like an urgent need for research that focuses on non-hormonal treatment options that might be better for mental health. And that kind of comes here with the lack of good treatment options, and that feeling, I guess, of feeling as though there aren't enough good options, really impacting on people's outlook having the condition. There were a number of problems raised to do with the structure of care, and in particular, some of the themes there were to do with the kind of integration between mental and physical health care, and everyone being kind of treated very separately, and the links not being seen by healthcare professionals, even when they were seen by the person themselves. A real lack of healthcare professional knowledge that people often encountered. Obviously, many of us well aware that endometriosis is quite poorly understood in general, but actually also really quite poorly understood by many clinicians still. And there were lots of examples of this, and that linked to this kind of idea of a burden of self-advocacy and informing yourself. And I think, you know, I'm sure many people listening will be familiar with that sense of kind of needing to get really informed and be able to kind of take on this system that isn't set up to really help you. But that is obviously a really big burden when people are already struggling in lots of ways. So just moving on, apologies, I can't. So this is another quote, and I think it really sums up that kind of idea about the disjointed nature of different parts of the health system and the way that it doesn't see people in a very holistic way a lot of the time, which I think is quite central to this kind of endometriosis mental health question, and what could be better around that.
So something else that was raised quite a bit within our focus groups, and was something that hadn't really been explored in a lot of research previously that we could come across, but was quite prominent, was experiences and barriers that people had specifically related to mental health care, so beyond gynae and beyond seeing your GP, but actually seeking support for your mental health. So there were kind of a range of experiences and barriers, and this was quite rich and complex. So one of them was unfortunately often in parallel with difficulty accessing endometriosis care. Lots of people reported difficulty accessing mental health care as well. And that sometimes when care was offered or when they were finally able to access care, that what they were offered was often not suitable. So sometimes this was not suitable in terms of being something that was very tailored to specific mental health conditions and not necessarily kind of understanding the impact of endometriosis on people's lives. So not, again, seeing people as a whole person, which then had a kind of negative knock-on effect on people's experience, both because it's ineffective and because it's demoralizing. In addition, some of the kind of mental health care options that were described were either very short, very prescriptive, or they weren't building on kind of emerging evidence around effective therapies. So some therapies that were raised that people kind of expressed interest in having both more research and more access to were around kind of body-based therapies, long-term therapies, and kind of a range of more rich and diverse support for mental health. In addition, something that came up quite a lot was the need to have tailored mental health support that acknowledges explicitly endometriosis, and for mental health clinicians to have an awareness of the condition and a way of kind of acknowledging and working with the lived experience of endometriosis, and not kind of trying to either shoehorn it into a different model or not discuss it within the therapeutic space. So this kind of need for tailored support was something that came up a lot. Unfortunately, another barrier that was raised several times was around people who also live with mental health conditions or who'd received mental health diagnoses, having this impact on the experience of getting endometriosis diagnosis and care. And this could be both through somebody's genuine mental health condition that they would also like care for, kind of interfering with clinicians' views on their endometriosis symptoms in a way that was not appropriate or supportive really for either of the mental or endometriosis aspects. Or sometimes people being incorrectly diagnosed with psychiatric conditions that then impacted how they were treated within healthcare more generally. So these are really concerning barriers, and these are really kind of an important area to consider and take forward further, because this has historically been neglected within the endometriosis space. And we thought this quote was quite a powerful one. So having access to trauma-informed therapeutic services as part of the endometriosis care package, because whether it's medical trauma, the fact of being disbelieved or gaslit, the impact that endometriosis has had on our lives, there is trauma. And just to return to what Izzy was saying earlier, so the discussions of trauma, while they were prominent, these were quite nuanced. And it's important to note that not everybody in our focus group, and, consequently not everybody with endometriosis, has the same kind of the views around the term trauma and the way that trauma is conceptualized within endometriosis. But this is something we wanted to draw attention to because it was an area of a lot of discussion, but it's also an area that has very limited evidence, both in research and in terms of actual practice. So this is something that should be kind of touched on more in future. So going into the kind of next theme that was raised within the focus groups, there was a lot of discussion around the way that endometriosis impacts people's kind of social well-being and relationships, and the knock-on effects that this has on mental health. So we had that quite powerful quote earlier on people's self-perceptions and this kind of the way that your symptoms can impact your social role, for example, as a partner, as a friend, as a family member, and how this, the way that this impacts how you see yourself can then really profoundly affect mental health, which is very linked to how we understand ourselves. In addition to also just having very profound negative effects that we discussed earlier. Something else that was raised. So we've discussed this in terms of healthcare professionals, but also in terms of people outside of healthcare. So colleagues, loved ones, people's reaction and their knowledge of endometriosis and how they kind of behaved and reacted around it was something that people raised a lot. And this could have a really profound positive effect where it was supportive, or a really significant negative effect. And often this could sometimes be because of direct, for example, kind of belittling about symptoms, but also due to indirect, questions like, are you all right, in the context of a chronic illness that relapses, causing quite a lot of burden for people emotionally, and impacting, how they felt they could connect with other people. In addition, so the impacts of pain, both on kind of social relationships, but also specifically related to sex, was raised, both in terms of how this directly impacted relationships, but also, interestingly, how this impacted healthcare. So there was a discussion around how that symptom in particular could often lead to kind of be taken more seriously within healthcare settings, not because of people's experiences of pain, but because of cultural norms around penetrative sex, and how this then ties into, heteronormativity, and other aspects of discrimination, as well as kind of gender-related discrimination as well. And that's something we'll touch on again, Lisa. So kind of returning to the more relational aspects, people also highlighted the value of being able to open up about this topic, both the kind of endometriosis experiences, but also how people saw that relationship with mental health within a group of other people with the condition. And this also tied into the kind of the value of peer support as a very important resource to bolster mental well-being. And this could be either in person or also online, and forums of resources were raised quite a lot as quite a powerful kind of protective area. And we thought this quote was quite a good kind of summary of some of these themes within this wider theme. So around how pain has affected this person's sexuality, and the kind of emotional knock-on effects and view of yourself as a result of this. I'll pass over to Izzy.
Thanks, Sarah. So I think, yeah, a theme that's kind of come up a little bit already here has been that around the kind of structural things that are going on that are driving, some of these problems and the real difficulties that face us as people with endometriosis. And there were many different kind of conversations really that related back to this in different ways. In one of the workshops in particular, there was a lot of discussion about gender inequalities around this, and whether the same degree of kind of neglect would be seen if this was a condition that affected everyone or affected men, was kind of raised there as a question. At the same time that there was a lot of discussion and kind of acknowledgement by people that within the group of people affected by endometriosis are a number of, different kind of gender identities, and potentially a lot of this is even harder for people who are assigned female at birth, but have maybe non-binary or trans identities. And so kind of we've tried to be quite careful not to sort of just talk about this as something that affects women, but recognizing that. However, I think there's a real gap around that in the way that healthcare is currently, set up, and the kind of common language and understandings. The same thing came up in relation to race, and that was, kind of in a number of different ways. There was kind of overt racism within healthcare, and we've got a quote that I think follows on from this, which was just a really shocking example of kind of like clear discrimination by a healthcare professional, but at the same time more subtle ways that kind of play out in terms of difficulties for people to express what was going on for them within certain cultures, more perhaps than the kind of majority sort of white British kind of cultural norms, and then services not being particularly well geared towards the needs of people from different cultural backgrounds and not particularly understanding. And that, I think, included both the physical health services, but in particular also perhaps the mental health and the kind of attitudes to mental health, there potentially being quite difficult for people to, you know, figure out their own ways within communities where the idea is really to kind of keep calm and not talk about these things that are difficult. There were other forms of kind of discrimination and inequality that also came out. So I think one was around class, and kind of some people discussed like whether their experiences and the kind of not getting very far with healthcare systems or being turned away or being dismissed were like made worse by being from working class backgrounds. Disability kind of rights came up quite a bit, and the way in which, I suppose, in particular, endometriosis kind of being disabling, also that ties in with the broader need for disability rights to be protected and you know, recognize and the kind of harmful media conversations that there are around that. And then a bit more kind of coming on, I suppose, a bit more positively, because we've got up the top here, kind of political failure. So there was very much, I think, a number of conversations that discussed the ways in which people kind of feel failed by the political class and kind of political systems in terms of this issue, and the kind of, I think, quite a lot of disbelief almost really that came across in just how bad things have been allowed to kind of get in terms of the experiences that people were sharing, and which, you know, all of us really related to. But then based on, you know, how bad all of that kind of feels, the real power of kind of collective voice, collective action, and getting involved in advocacy, both for individuals in terms of kind of taking on some agency in what can feel, you know, a very bleak and depressing and quite difficult thing to be grappling with alone, but to connect with other people that you share some of those experiences and difficulties with, and then try to kind of together use your voices, use your experience to drive change. Really, you know, I think it was something that did come out a bit, and certainly a lot of us really hope that, and that's the intention really of this project, is to provide, you know, more fuel and more evidence to support that collective work and that advocacy. I'll maybe let Sarah go to the next one. So this is the quote that I kind of mentioned before about the experience of racism that one of our participants had. And I'll just let you read it, but it's really shocking that this is still happening. You know, this is a fairly recent kind of experience. We're not talking about something 50 years ago. So, you know, that is perhaps quite a kind of one of the worst examples that we heard, but really, I think, demonstrates just how far there is to go in addressing some of these kinds of discrimination.
So, I mean, we've had a very intense overview of kind of the many intersecting factors, both kind of social health related to the actual condition itself, and how these work together to impact people's mental health. But something that's a huge personal bugbear as a researcher is describing problems without starting to try and think about solutions. And that was something that we asked people explicitly about in the workshops. You know, what helps, what is supportive, and what changes would people like to see in terms of kind of bolstering mental health in people living with endometriosis. And people raised a really kind of, again, very rich range of topics in there. So one of them, just at the kind of day-to-day level, people often spoke about different coping strategies and using distraction just to manage symptoms and to kind of, you know, treat yourself using small routines, or, you know, a nice food, something like that, just to have a kind of a positive moment in the day. And while this absolutely does not solve many of these kind of huge challenges. It was something that people often return to just to support their mental health on a day-to-day basis. At a kind of, I guess, higher level, people discussed various aspects of life and both what works and what would work. And one of those was around the workplace. So many people with endometriosis are in the workplace in one way or another, or would like to be. And while kind of a lack of support and a lack of understanding was definitely raised as a factor that was very unhelpful in terms of mental health, understandably, both where colleagues in workplaces have been flexible and supportive, or the potential to kind of raise awareness in workplaces, push through better understanding and better legislation to support people with endometriosis or people who are disabled by their endometriosis in the workplace, was something that was raised as really important. Additionally, healthcare being such an important kind of determining factor on this endometriosis and mental health experience, it's not surprising that both having had positive experiences with healthcare professionals, so those that listened to people, that helped them kind of move forward on the pathway, that didn't, gaslight, that accepted people's experience at face value. This was raised as something that was really positive for mental health. And, perhaps being able to kind of raise awareness and support that further with other healthcare professionals is something that might be able to improve the frankly quite substandard care that's often being experienced now. Something specific within this kind of sub-theme was around endometriosis nurses. So this was something that some participants had access to. And these endometriosis specialized nurses were kind of universally raised as a really positive part of the endometriosis care pathway, but unfortunately were not accessible to a lot of people with the condition. So this was something that really came through in our study. Additionally, some people reported that certain medical or surgical treatments worked well for them. There had, of course, as we've discussed, been many negative experiences with those, but where those helped to relieve pain, that had a really transformative impact on people's mental health. And that kind of raises, again, the importance of understanding better which treatments work for different people with the condition, which will be most effective. And when some are likely to negatively versus positively impact people's mental health. So having both kind of further breakthroughs in terms of treatments, but also a better understanding of how to use the treatments that we have available now and how to make those clinical decisions. Finally, people often raised kind of support from loved ones and also from other people with endometriosis, and just finding community as a really critical source of kind of, strength and support in order to cope with living with this condition. And, both kind of facilitating that was something that was raised as another potential area to kind of bolster mental health while going through the endometriosis journey. And that was kind of the final quote that we wanted to bring from the workshops, was around community. So one of our participants said, "I'm a firm believer that community is such an important part of surviving endometriosis. In terms of mental health, community is one of our biggest tools." And we thought that was just a really powerful sentiment. I'll pass over to Izzy.
Thanks, Sarah. I think we didn't want to say that much really about kind of specific recommendations. I think you've heard what some of those are likely to kind of relate to from the different themes that have come out. But there are a lot of different clinical audiences that we're thinking about how best to convey these findings to, and what the kind of key takeaways are for some of those different ones, which are obviously different depending on the particular context. But some of those things around really addressing the need for better understanding of these links, not kind of using people's mental health conditions or diagnoses or the possibility of that in a harmful way for their physical health care, but conversely, that there should be that understanding of endometriosis within a mental health context, and perhaps more specialised, more tailored support. And so advocating potentially for that. But I do really want to allow us enough time to come on to the Q&A. So if there are questions, particularly around the recommendations or also suggestions, then I think we would really welcome that, because, you know, you can also feed into this project. We are very open, I think, to your suggestions. So please do feel free to let us know in the Q&A if there are key areas that you think that maybe have been kind of missed off, or that you think should be really centered as recommendations from this. We'd love to know that. So I guess I'll just, suggest that we kind of move on to a bit of time for Q&A, just having a bit of a look through. Oh, okay, on the next step. So this is broadly where we're at, is working on finalising the journal paper, and we will share an early view of that with the people that took part in the workshops. We are looking to make a shareable video that should help kind of convey some of the key findings just in a few minutes to people. And we're going to run a kind of more policy-oriented webinar with policymakers and clinicians in the autumn, when hopefully that paper will be finalised, and thinking about dissemination through media and social media, particularly to reach members of the public, but also to kind of raise the issue up policymakers' agendas. I think we can just close the presentation part by saying thank you very much to all of the workshop participants who gave their time and their kind of very open, quite vulnerable contributions, which made the research possible, and also to our partners, Endometriosis UK, UCL Grand Challenges, and the Co-Production Collective, and absolutely kind of centrally to the patient researchers and the wider team who have just been incredible to work with.